We're cheering for sure. It is Wednesday, and the doc's on call with Wave 3. That forecast could be right on time for this segment, because today we're talking with Dr. Jarrell Matos. He's a surgeon at Kleinert and Kutz Hand Care Center, and I would assume that you start seeing a few hand injuries that are related to yard work and such, and maybe increased in sports activities with the good weather.
Oh, absolutely. As the springtime comes around, people become much more active. You see athletes get back on the field, so you'll see a lot more wrist injuries and wrist fractures and tendonitis, and which
is this in all ages?
This is all ages, from children to older adults, especially those who might get back to starting to play tennis. See a lot of tendonitis there, and again, a lot of wrist fractures as well. Other thing you might see, getting back out on the yard, you see gardeners. They tend to get a lot of thumb pain. So patients who might have a little bit of arthritis that might have been dormant during the wintertime and the holidays now starts to really act up and can really cause a lot of pain. We have a number of treatment options for them as well. And then let's not forget...
All surgical?
Well, not all surgical. Sometimes it's just an injection or a brace, but...
Well, that's what I guess that's a good question, though. I mean, when do you know that it's time to see a surgeon?
Well, you should, as hand surgeons, it's probably a misnomer. We're more hand specialists, so we see everything from the beginning where it might not need surgery to the end where you really, your best option is surgery. So we might just start with bracing or therapy or
prevent the surgery.
Exactly, cortisone shots, and eventually we'll progress to surgery. Surgery is usually a last resort for most of these problems.
And what kind of symptoms should get you to the doctor?
Oh, well, we start with pain, of course, and then just take a note of what activities actually cause the pain. Is it opening a jar or working with certain tools? And really, you just pay attention to what specific motions cause the pain.
I know a lot of people will think, I'm just going to wait this out a little while and see if it will resolve on itself.
Now, sometimes it does. I mean, but you have to wait years for that to happen. So no one really wants to wait years. You're much too busy.
But is there a time limit? I mean, if it's been going on for 2 weeks or 4 weeks or...
Yeah, just I would just wait a couple weeks. Anything that doesn't go away in 2 weeks, someone should take a look at it. Now, the doctor might say, you're fine, this is going to go away, and that's reassuring, I think. But sometimes there may be something else going on.
And sometimes can you do some physical therapy too?
Oh yeah, we have a whole hand therapy department that and that really takes care of these, and have a whole arsenal of tools that we can use to treat anything from tendonitis to muscle strains and then rehabilitate you after wrist fractures or even with your arthritis as well.
And I imagine it's that if you do let it go on, that a lot of times fixing it can become much more difficult.
Yeah,
the quicker you get to the doctor, the quicker you're going to get back in action.
That's right. It might be more challenging for you in recovery, and usually a little bit more challenging for us. But you'll definitely have a good result, I think.
All right.
Longer recovery for sure.
Well, thanks for being with us again. I don't think we've seen you since last fall.
Yeah, that's right.
Thanks for stopping by. We appreciate it. Dr. Jarrell Matos with Kleinert and Kutz. Thanks so much.